Hello, my name is Sarah Allred. I'm a registered respiratory therapist and a trainer with Neonatal Rescue. In this video, we will discuss the Helping Babies Breathe Action Plan. This plan is a series of steps to be used following delivery to help newborns transition to life outside the womb. This algorithm was designed to be used by healthcare providers with limited resources. The first step in this algorithm is to prepare for delivery. This is done by checking the health history for mom and baby, ensuring well-trained healthcare providers will be attending the delivery and assembling clean equipment. When available, the equipment should include gloves, cloths, a covering for the baby's head, scissors, ties for the umbilical cord, a suction device, a ventilation bag mask, a stethoscope, and a timer. Once the baby is born, dry the baby thoroughly. Drying will help to stimulate breathing while keeping the baby warm. Clear the airway of meconium if present. After drying, check to see if the baby is crying. If the baby is crying, it is a good indication that the baby is breathing well. If the baby is not crying or is gasping, they will need immediate help breathing. A crying baby can receive routine neonatal care. The baby should be positioned skin to skin on the mother's chest to keep the baby warm. The baby may be encouraged to try breastfeeding. The baby's breathing should continue to be monitored during this time. After 1 to 3 minutes, the umbilical cord may be clamped and cut. Delaying cord clamping allows the baby to receive additional blood from the placenta. When cutting the cord, ties should be placed at about 2 to 5 fingers lengths from the baby's stomach. The cord is cut between these ties with a pair of clean scissors or a knife. The tie remains in place and the cord is left to the air to dry. Once the cord is cut, neonatal care may continue as routine. Next, we will cover the golden minute. The goal of the golden minute is to have the baby breathing well on their own or receiving ventilation by bag and mask within 1 minute after birth. The following steps make up the golden minute and are designed to stimulate newborn breathing. If the baby is not crying after delivery, continue to warm, dry, and stimulate the newborn. This can be done by rubbing the baby's back, covering the head, and placing the baby skin to skin. Clear the airway of meconium or any secretions preventing the baby from properly breathing. The baby's head should be positioned so it is slightly extended. After the baby has been stimulated, check again for adequate breathing. A baby is breathing well if they are crying or if they are breathing quietly and regularly. If the baby is still not breathing well on their own, begin to ventilate the baby with a bag and mask. When ventilating a neonate, the head should be slightly extended and the mask should create a tight seal around the baby's mouth and nose. Gently squeeze the bag to give the baby 40 breaths per minute. Assess the baby for slight chest rise. If the baby's chest is not rising, reposition the head and ensure the mask is properly sealed. Once the baby's chest is rising gently, continue to ventilate for 60 seconds. If the baby is still not breathing following the golden minute, call another trained healthcare provider to help improve ventilation. They may help by repositioning the baby, clearing secretions, or achieving a more effective seal with the mask. If the baby still is not breathing after improving ventilation technique, check the baby's heart rate. This can be done by listening with a stethoscope or feeling the base of the umbilical cord. Determine if the heart rate is normal or slow. If the baby's heart rate is normal, but the baby is still not breathing, or if the heart rate is slow, continue trying to ventilate and reevaluate the baby's heart rate every 3 to 5 minutes. If the baby's heart rate is slow, or if the baby is not breathing after 20 minutes, discuss options with the parents and consider stopping ventilation. If there is no heart rate and breathing after 10 minutes, stop ventilation. If a baby never breathed or had a heart rate after birth, they are considered stillborn. If the baby responds to ventilation, they can be returned to the mother and receive standard neonatal care. The healthcare provider should continue to monitor the newborn for additional signs of respiratory distress. Thank you for watching this segment on helping babies breathe. Please reach out to us with any questions by emailing training@neonatalrescue.org.